Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Have you ever wondered why a single song can relax your pulse more quickly than medication? Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and alongside me is Alara Sky. Today you'll discover how using music with intent can accelerate your healing.
Thanks, Ethan. I'm excited to guide you through the science behind music therapy, a medically recognized intervention for conditions ranging from stroke and traumatic brain injury to Parkinson's and dementia. We'll focus on the hard data, no fluff, so you can decide how music might fit into your own recovery plan.
First, let's ground our conversation in evidence. Clinical teams worldwide now prescribe music the way they prescribe rehabilitation exercises. For neurological patients, structured listening or singing sessions can restore speech, improve gait, and lower anxiety without drug side effects. Outcomes conventional therapies rarely achieve alone.
That advantage comes from what researchers call whole brain stimulation. When you play a melody, your auditory cortex decodes sound, your limbic system processes emotion, and your motor cortex anticipates rhythm, all at once. That simultaneous activation rewires pathways more efficiently than treatments that target a single region.
Consider surgical recovery. A meta-analysis in The Lancet showed patients who heard music before and after operations needed significantly fewer opioid painkillers. Pain scores dropped, hospital satisfaction rose, and the only variable was sound, not another pill. That's a cost-free intervention any hospital or household can deploy.
The biological reason is straightforward. Slow, rhythmic pieces cue your parasympathetic nervous system. Your heart rate eases, blood pressure normalizes, and cortisol, your primary stress hormone, drops. Lower cortisol means less systemic inflammation and faster tissue repair, giving you a biochemical head start on healing.
The speech center example is equally compelling. After a stroke, some patients can't form words, yet they can sing entire lyrics. Therapists leverage that by having you vocalize phrases on a melody first, then gradually transition to speaking. Over weeks, neural circuits governing language reroute through musical pathways.
Parkinson's patients see parallel gains, rhythmic auditory cues, think steady drum patterns, entrain your steps, smoothing the shuffling gait common in the disease. Because the beat is predictable, your motor cortex syncs leg movement to the external pulse, bypassing faulty dopamine signaling that would otherwise cause freezing.
The physiological depth of these effects surprised even surgeons. In many trials, music reduced pain markers during general anesthesia when you weren't conscious at all. That indicates the auditory system can modulate your stress circuitry independent of awareness, something pharmacology alone can't replicate.
It also underscores why patients report feeling safer and more respected when caregivers include music. Anxiety drops, compliance improves, and satisfaction scores climb. From an operational standpoint, you recover faster, and hospitals spend less on medications, making the practice both clinically and economically sound.
Renowned soprano Renee Fleming highlighted these findings while discussing melodic intonation therapy. She described stroke survivors regaining words within a single session of targeted singing. That rapid turnaround speaks to music's ability to reach neural networks no other stimulus can access so quickly.
Evolutionary biology may explain why. Humans, unlike other primates, naturally synchronize to a beat. This trait developed alongside complex vocal learning, suggesting rhythmic coordination is hardwired. When you tap your foot or hum in unison with others, you're activating systems shaped over millennia to foster connection and resilience.
Active engagement appears to deepen the effect. Imaging studies show that imagining yourself singing can light up more brain areas than speaking aloud. The mental focus required to coordinate pitch, breath, and phrasing challenges. Your cognition, in a way, passive listening simply doesn't.
Regulators are taking note. 12 U.S. states now license music therapists, and the National Institutes of Health has invested roughly $40 million to standardize protocols. As policies mature, you can expect structured music programs to become as commonplace as physical therapy referrals.
Let's shift from hospital corridors to your living room. If you want to leverage this evidence, start with nostalgia. Revisit songs you loved as a child, tracks that made you dance or cry. Familiar melodies reawaken neural pathways formed early in life, instantly grounding your mood.
Next, build what researchers call a state-shifting library. Create 3 playlists: one that calms you, one that energizes you, and one that lets you release grief through tears. Use them deliberately. When anxiety spikes, press play on the soothing list instead of reaching for caffeine or scrolling feeds.
A third step is mindful listening. Give yourself a single track each day where you do nothing else. No chores, no conversation, just absorbed attention. Close your eyes and follow each instrument. This brief focus activates your vagus nerve, guiding your body into that sought-after rest and digest mode.
Fourth, harness rhythm to reset your internal clock. Choose percussion-rich or evenly paced music at consistent times, right after waking and just before bed. Regular exposure entrains circadian signals, smoothing appetite, energy, and sleep patterns without adding another supplement to your regimen.
Finally, make music social. Join a community choir, tap on a hand drum with friends, or simply sing in the car with your children. Group rhythms boost oxytocin, the bonding hormone, giving you the same physiological lift you'd get from a supportive hug.
Put together, these 5 strategies turn background sound into active therapy. You're not adding hours to your schedule or money to your budget. You're repurposing an everyday stimulus that your nervous system already trusts. All you need is intentional selection and focused listening.
Before we set your homework, let's underline why this matters in everyday stress. Studies on postoperative care showed that when you replace silence with melody, you decrease pharmacologic sedation requirements and shorten length of stay. Nurses report shorter discharge times when post-op playlists are standardized, and families notice less agitation in recovery rooms. Beyond surgery, similar protocols in cardiac rehab have improved endurance and reduced perceived exertion, reinforcing music's versatility across specialties.
The emotional dimension is just as profound. Trauma researchers find that music accesses preverbal memory, giving you a safe channel to release stored tension without re-experiencing the event. Over time, that relief lowers systemic inflammation markers associated with chronic disease and helps stabilize mood cycles.
A common question we hear is, what genre is most therapeutic? The evidence points not to a specific style, but to personal resonance. Whether it's classical strings, gospel harmonies, or classic rock, choose tracks that reliably evoke the state you're targeting. Your history matters more than tempo charts.
Another FAQ involves duration. Research shows benefits begin within 3 to 5 minutes, but sustained sessions of 20 to 30 minutes produce deeper autonomic shifts. So, if time is tight, commit to one focused song. When you have space, let an entire playlist guide your physiology.
So, here's your challenge. Today, choose one childhood song and listen with full attention for at least 3 minutes. Notice your breathing before and after. Tomorrow, build the 3 playlist toolkit we outlined. Keep it handy for 7 days, using each list daily. Track how your pain, mood, and sleep respond.
Consistency is the secret. Give the protocol a week, observe the changes, and adjust your playlists as needed. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.